Have you ever wondered about skin injuries which can heal very quickly while others leave a scar for life? I always wondered what's the worst our skin cannot recover from. So let's break down what our skin can recover from and what damage stays forever. This might change how you treat even the tiniest scratch. Let's hit it. A general recap: high school biology level. Our skin has three main layers: the epidermis, the outermost protective layer; the dermis, a thick middle layer with blood vessels, nerves, and hair follicles; and the hypodermis, the deepest layer of the skin made of fat and connective tissue. How deep an injury goes determines how well it heals, or if it ever can. So let's go to the first outermost layer, the epidermis. If you cut only the epidermis, like a paper cut or a shaving neck, you're golden. No blood, no scar. You can see the blood visible, like very near to the skin, but there won't be any outpouring of the blood. The skin regenerates in a few days using cells from the basal layer. It's like it never happened. Best analogy for it is basically performed an undo operation. But in our case, it takes a lot of time. Also, a first degree burn, like a mild sunburn, only damages the epidermis. It may cause redness, dryness, and maybe slight peeling, but no blistering. So it doesn't go deeper and it will heal in about 3 to 6 days, usually with zero scarring. Let's move on to the second layer, the middle layer, the dermis. It goes slightly into the dermis and now blood is involved. That's where clotting begins. Fibroblasts build new collagen and the skin closes up. Now, most of these heal clean, but may leave a faint scar or a discoloration. These too will fade over time, but it will take months and weeks. Then there are abrasions, like when you scrape your knee. Now, these damage the epidermis and sometimes the epidermis, but not deeply. Slight outpouring of the blood, but not too much. Painful? 100% yes. But they usually heal fast with minimal scarring. It's basically a bunch of parallel lines when you scrape. So, unless they are infected or repeatedly reopened, no harm at all. Now let's come to bruises. That's bleeding under the skin. No break on the surface. The color change is distinct and fairly visible, but that's your body recycling the blood. So for it to heal, just patience. It's not internal bleeding, it's bleeding under the skin. Now let's talk about surgical cuts, like stitches from a surgery or a planned incision cut. These are usually clean, straight, precise, which makes a huge difference. As long as you have a very good surgeon who knows what he's doing. Surgeons cut in a way that minimizes skin tension and damage, often along natural skin lines. That's why with proper stitching and care, most surgical cuts heal with thin, flat scars or sometimes none at all. But again, it depends on your genetics, skin type, and how well you heal and the mode of operation. Like if you have a knee replacement surgery, it's going to leave a distinct scar. Now, it does fade away, but people will still be able to spot it. Now, if the same spot gets cut, scraped, or reopened again and again, the healing gradually weakens. Collagen gets disorganized, scars become more visible, thicker, or darker. Your skin doesn't forget. It builds tougher but uglier, and it may be difficult to fade this. Full thickness injuries. When injuries reach deep into the dermis, like second or third degree burns or deep gashes, that's permanent territory. Hair follicles, sweat glands, and even nerves are destroyed. Body rushes to seal it, but it cannot recreate what was lost. The result, a distinct scar. In some cases, it doesn't even stop. It gets worse. Moving ahead in the same category, we have keloids and hypertrophic scars. Some skin overreacts. It forms keloids, thick, raised, really big on the skin, ugly, and sometimes these scars grow beyond the original injury. Common in darker skin types, especially on chest, shoulders, and the earlobe. These scars don't fade and often return even after removal, and they may never fully close or regain function. Poor circulation, infection, or autoimmune conditions stop the healing. These need lifelong care and they become a part of it. The skin becomes fragile, inflamed, and vulnerable to future injury. So in the end, there's a list of skin diseases that leave a distinct mark. These aren't exactly damages, physical damages, but diseases purely. So non-injury skin issues, psoriasis, which can thicken and disfigure the skin, severe acne, which can cause deep-pitted scars, holes, like on the sieve mark, and then vitiligo, which wipes out the pigment cells, usually permanently. These aren't cuts or burns, but they rewrite your skin's map just the same. So the best way to treat this is you can apply ointment creams. There's also an option for laser treatment for serious cases of psoriasis and keloids. But the best way to do this is obviously consult a physician if you need it. So skin is incredible at healing. It's really beautiful up to that point, but once deeper structures are damaged or the healing process goes off track or slowed down, the results are permanent. Every mark tells a story. You should reach a compromise. Which part of the skin you can hide, which part of the skin kind of hinders your look, kind of affects your confidence, uh, affects you mentally, and then you should take the appropriate medical action. What you do stays with you forever. So tell us your story if you have a scar that never faded in the comments. Thank you.